Hello, I'm Annie Nickel, and I'm the current chair of the Clinicians Steering Committee. I'm so excited to introduce our awardee today. The Clinicians Network is the nation's leading membership group that connects hands-on providers from many disciplines who are committed to improving the health and quality of life people that are homeless are experiencing. Our award today is the Karen Rotundo Award for Outstanding Service. The Clinicians Network Annual Award for Outstanding Service honors the memory and legacy of Karen Rotundo, the founding mother of the HCH Clinicians Network. It is awarded to exemplary clinicians in the homeless healthcare field annually. And today's award is going to Asma Inga Hanif, and I'm going to tell you a little bit about her. She shared with me that she's fairly shy at coming to the podium, so I thought that I would give you a little bit more insight into what she does and who she is. She is the founder and executive director of Muslimat Al-Nisa Shelter in Baltimore, Maryland. In 2007, she opened her home to shelter homeless Muslim women, victims of domestic violence, to fulfill an unmet need. Her goal was to provide a culturally competent, faith-based environment to assist women in their recovery and rebuilding their lives from the myriad of life traumas by removing the handicap of homelessness. Ms. Inga Hanif's work is rooted in her belief that every man, woman, and child has a right to receive quality care in a dignified manner, and to be assisted in that achievement of optimal health without regard to race, creed, or socioeconomic level. Asma Inga Hanif graduated from Howard University and as an advanced nurse practitioner. She is also a certified nurse midwife, having taught at universities in our country. In 1987, she established a health and social services center to care for underserved and uninsured women and children. Her original motivation was as a response to her maternal grandmother lacking health care and dying from a preventable condition. She has worked tirelessly and caring for the homeless, refugees, trafficking victims, and women of domestic violence for over 30 years. The nominator for this award gave me a little bit of insight into some of the things that have happened to her recently. Society has not been kind to her. Earlier this year, her organizational website was the target of a cyber attack that sabotaged display elements of the site and caused a decrease in the ability of donors, which decreased her ability for financial support in those in need of shelter. Despite this difficulty this internet hack created, instead of hate, she offered forgiveness, because she said forgiveness diffuses the effect of bad intention. She also stood with the people of Charlottesville, and I share with you below what she wrote. The people of Charlottesville stand peacefully against a display of hate. I pray for souls which were lost. I stood with Charlottesville because I felt their pain. I am a person of color, born in Virginia, of Native American and African descent. I feel the pain of having land stolen and the oppression of enslavement. I have felt the pain of racism, discrimination, and hate. Yet I never have cursed my ancestral gene pool. I am one of God's creations, and I am pleased with the color of my skin, my gender, and the path assigned to me at the birth of my Lord. I choose not to be overtaken by sorrow. I do not succumb to the hate toward me from others, but instead I maneuver around it. When forced to deal with the issue of race, bigotry, and hate, The damage imposed by the godless must be restored by the God-fearing. She also quoted at the end of this, of what we just reported, a truer American symbol of liberty and welcoming home for immigrants who entered the United States is not a man, but it is a woman, the Statue of Liberty. And she quoted Emma Lazarus, who wrote a plaque for the bottom of the Statue of Liberty, and I'm going to read what she wrote. I think we can all take something home from this. This is the entry into America from the Atlantic. A mighty woman with a torch, her name, the Mother of Exiles. From her beacon hand glows worldwide welcome. Cries she with silent lips, give me your tired, your poor, your huddled masses, yearning to breathe free. The wretched refuse of your teeming shore. Send these, the homeless, tempest-tossed, to me. That was America at its best. Asma?
Thank you. It's customary to say that it's an honor to be awarded anything for just helping others. But as I thought about it, I asked, what has happened to society that people are given awards for just being humane? Being humane should be the norm. And when asked why we do what we do, any of us here, you look back on your life, and I think about a song as the reason behind it, giving back to humanity, based on the path that others have already created for us. That's why we're here. And my reason was not for an award or because I think I was doing anything great, but rather, as it's said, if I can help somebody along the way, then my living has not been in vain. And that's all I want, that my life made a difference in the lives of others, and my being here was not in vain. Thank you so very much.
Good afternoon, all. Welcome to this portion of the award ceremony. I am the outgoing chair of the NCAB Steering Committee, Rodney Dawkins from Chicago, Illinois. And today we're here to honor Jacqueline Hardy, community advocate, and someone that you should know. From Birmingham, Alabama, the Ellen Daly Award winner, the National Consumer Advisory Board Ellen Daly Award honors the spirit and the strength of the founding member, Ellen Daly, a passionate champion of consumer voices in the provision of homeless services, who was instrumental in the starting the Consumer Advisory Board at the Boston Healthcare for the Homeless program in Boston, Massachusetts, and the NCAB Steering Committee. So right now we're bringing forth the Director of Homeless Services, Amy G. Sparks, who has worked alongside our award winner.
Good afternoon, all. I am Amy Sparks. I have been with the movement for over 30 years. Doesn't seem like it's been that long. And one of the honor that I have today is to present the winner of the Ellen Daly Award. The winner who we are honoring today is a passionate, caring, energetic, powerful voice for the community of Birmingham, Alabama, as well as the state of Alabama. I have known the recipient for many years in many capacities. It's probably been over 10, 11, 12, many years, many years. Jackie Hardy, the recipient, is not a quiet person. She sees a need and she goes and takes care of it. She makes sure that everyone knows that she's there taking care of the need, and no one can turn her down. Jackie and I have a special relationship. She is not only a member of our board of directors, she's someone that calls me whenever she feels like it, wherever I am, regardless, Monday through Friday, 7 o'clock in the morning, 7 o'clock at night. Many times I tease her and say, your phone just calls me and called me all night long. And she goes, I know, Miss Amy, your number is the first number on my phone, so it automatically calls me. So sometimes it's like, this is Jackie, she doesn't want anything. But when she wants anything and she doesn't get me, believe me, she shows up at my office and everyone says, Miss Amy, Jackie is here. I said, well, just tell Jackie I'll be right there. Because she will make sure that if she has to wait 2 hours, she'll go and come back. When Jackie was going through some of her struggles, I remember she made me so mad one day, and then she said, I think I'm through. I said, okay, get in the car, let's go. And I took her to her apartment. She had 10 minutes to get what she needed. Threw it in my car, took her to where she needed to do, and she hadn't stopped looking back yet. And it's just a joy to see what she has accomplished. I'm going to let Jackie talk a little bit about herself and the accomplishments that she has done for the state of Alabama, for the underserved, for the needy, and everyone that looks around will know that, hey, this is a dynamite that we really got to keep going. Jackie Hardy.
Thank you. Hello, everyone. Thanks for having me. I'm going to share a little bit about who I am and my struggles and my accomplishments. Thankfully, I am a part of an organization that cares for the community. And Ms. Amy Sparks, she was very, very honest about saying, I am determined. Alabama Regional Medical Services play a big part of my life, and like she said, I am a board member, and I'm going to continue to do all I can for the communities. So a little bit about me. Back in years on, I was actively in my addiction, and my addiction took a lot of things from me that I said that I was going to regain back, and I was not going to allow my struggles to hold me down. So instead, I allowed my struggles to be my strength. So today, I stand before you and I tell you that I founded an organization, ACT, Action Changes Things. And I did that due to the state of Alabama. If you're not familiar with our policies, they'll hold you down for life. If you ever go to prison or get a felony, a drug felony, I might add, you'll be held down for life in the state of Alabama, where you cannot get any benefits. So once you come out of prison, which I was in that situation. I was told that I was banned for life from the SNAP and TANF program, which wouldn't allow me to go into the grocery stores and buy nutritious foods like vegetables and fruits. I had to eat out of food pantries and work from job to job, which when that job ended through temporary services, I had to move forward to another one because no one would hire a felon. So I'm looking at the situation and I'm saying, something's not right with this picture. You mean to tell me a person can go and kill, rape, anything under the sun in the state of Alabama and receive food and TANF benefits, but myself, who got a drug conviction, is banned for life from eating in the state of Alabama? So I refused to take that. And I did my research, and once I did my research, I was dumbfounded. I found out that not only the state of Alabama held these individuals down with these priors, but the individuals was allowing this. For over 2 decades, this law had been in effect. So I said, no, I'm not gonna take this. I'm gonna step out of this circle, and I'm gonna move forward. And I went to the state legislators, and I went to the senators, and I talked to them, and I told them my story. And one of the persons that I'll never forget is Senator Linda Coleman in the state of Alabama. She said, if you and your organization stand behind me, I'll push this bill. And we stood behind her for 3 years. 2 years that bill died in the House. But the 3rd year, that bill passed, and now tens of thousands of Alabamians get these benefits. Now, I don't want to stop there because no one wants to rely on food stamps for the rest of their life. You want to move forward, and you want to use that for a stepping stone so that you can move on up. So now what our organization is doing is we're fighting for Ban the Box. And I don't know if you're familiar with Ban the Box. And to those of you that's not familiar, so if I come into your employment and I apply for a job, there's a box on the application that asks me, am I a convicted felon? And because I'm a convicted felon, you don't have to interview me. You don't have to get to know who I am. You can take that application and shred it and not call me back. But we're trying to get that box off of those applications so that you will actually interview me and get to know me. And maybe I'll be an asset to your company, and I'll stay there for years and years to come. So I have many chapters in my life, and this chapter, I would like to thank you for being a part of it because you've just entered into my chapter. Thank you.
Good afternoon. It's a pleasure to be here and present the winner of the 2018 John Lozier Scholarship Award for new members. First, though, some of you may not be familiar with John Lozier. In 1985, John established and directed the Nashville, Tennessee Downtown Clinic as part of the Robert Wood Johnson Foundation's National Demonstration Program in Homeless Healthcare. Within that program, he organized his peers into a Project Directors Council, which outlived the foundation funding and evolved into the National Healthcare for the Homeless Council you know today. The overarching theme of John's work was building an inclusive national community dedicated to healthcare justice. John retired as the Council's Executive Director at the end of 2016. The 2018 winner of the John Lozier Scholarship Award is Dean Williams. Dean is a community health worker for Seattle's Neighbor Care Health's youth clinic. Dean focuses on the unique healthcare needs of homeless young people. He provides outreach to young people in numerous settings, including shelters, drop-in centers, tent encampments, and those on the streets. Dean is passionate about his work and dedicated to both equity and justice for the teens and young adults he works with. He also promotes a collaborative model of treatment, ranging from other Neighbor Care team members to various community agencies. Dean takes a trauma-informed care approach, utilizes motivational interviewing techniques to best help his patients, and treats them all with dignity and decency. Dean himself has been homeless, and so he has a particularly personal knowledge of what can have the most positive impacts on the teens and young adults he serves. Dean.
Thank you for that. I made some notes. Give me a second. I want to thank John Lozier, specifically just because he made all this possible in this place with all you amazing people. And the people that I work with, my colleagues, they made it so that I was capable of being in this type of position. A little bit about myself is, like Seth said, I was homeless at one point in time, multiple times in the past, and an issue I myself and I know many others have had is you sometimes feel less than human. You aren't always treated with respect. You aren't always felt like you belong. But whenever I went to the youth clinic that I now work at, I was treated like a real person. People would talk to me, have casual conversations that you wouldn't really think are that important, but to someone like me, it was everything. And now in my work, I try to be that same person. I do my best to make the people that I talk to feel normal and like they're my equal. So, thank you.
Hello, the next award is named after Philip W. Brickner, Dr. Brickner, who I was very privileged to get to know over the years. And I like to say that Dr. Brickner and his team that included Barbara Kananen and Marianne Savarese and many others were doing healthcare for the homeless before there was healthcare for the homeless. And in our program, it describes how he was tapped to lead the National Demonstration Project, which was funded by the Robert Wood Johnson Foundation and the Pew Memorial Trust, which was so successful that when the federal government said that we want to do something about finding out how we can provide health care to people experiencing homelessness, they just pointed to the 19 cities in this program and said, we're going to replicate it. So due to his work, there are now over 300 healthcare for the homeless grantees, at least one in every state, Puerto Rico, Virgin Islands, and Washington, D.C. I first met Dr. Brickner in 1988 at the Exit Conference when I was just beginning at Care for the Homeless, the Exit Conference with the two foundations and the New York City Healthcare for the Homeless program. My title was staff assistant, and I was amazed that over the years, though I had just met him that one time, he never forgot my name. He never forgot me, and I thought, who is this giant that is so humble? The last line of the program describing him says, it just talks about his commitment to social justice, compassion, humility, inclusiveness, innovation, intellect, and persistence. And that really summarizes him. It also describes this year's Brickner Award winner, and this award is conferred by the Board of Directors. It is the only award that is conferred by the Board of Directors. And John Pravinsky, and you see in his program, is the president and CEO of the Colorado Coalition for the Homeless. That they serve over 13,000 unique individuals, and they also have developed 600 units of housing and more than 2,000 supportive housing units. It's amazing. I was privileged to go visit them last year, and their clinic is absolutely beautiful. I've known John for many, many years, and he is also a humble giant in the mold of Dr. Brickner. His humility is evident to all who know him. He has a string of awards that you would never know. You would never know it from him, but his work speaks for himself. A few notes before I turn it over to John Pravinsky. It doesn't say here in our program, but he is a lawyer by training, which upsets me because it puts the lie to any mean lawyer joke I would want to say. He is also committed to helping us learn. People say, how did you develop these healthcare services? How did you develop this supportive housing? How did you come to administer over 600 housing vouchers for families? How do you have the ear of the mayor of your city? How are you on all these commissions? He's committed to helping us learn. And shortly, he and his team have been working with the council staff on a case study that will be published very soon by the council on how they did their housing work. So I invite you to look out for that, and also in the spirit of true health care for the homeless, learn from that, and as we continue to learn from each other. Many people that go on a tour of Colorado Coalition for the Homeless to their health clinics come back, and there's one phrase that everyone says, and that is foot baths. Did you see the foot baths that are in almost every clinic room? They took the time and thought when they were designing their clinic to build in foot baths because they knew that's what their patients needed. That epitomizes what healthcare for the homeless is all about. We thank you, John, for being one of our leaders by example, and we ask you to come forward now.
Thank you so much. It's a great honor to receive recognition, particularly from an organization and a community that I hold in such high regard. I was attracted to the work of the National Health Care for the Homeless Council for many reasons. The foremost was their commitment to the belief that health care is a human right, and housing is a human right. And together, housing is health care, and that's what we live every day. Now, I've never known a more compassionate, open, and welcoming community in the group of folks that are in this healthcare for the homeless movement. And as I accept this award, I cannot overstate the fact that none of what I have done, none of the work that we have done together could have been accomplished without the commitment and the dedication and the tireless work of the staff and the consumers of the Colorado Coalition for the Homeless. Many of them are here right now. They are awesome, and they will always be my hero. Give them a hand, please. Now, as Bobby said, I came to this work a little bit differently than most who are here today. I'm not a doctor. I'm not a nurse. I'm not a social worker. I'm really not even an administrator. I came to this work as an attorney who went to law school to learn the tools and the skills to help the social justice movement. I learned social work and community organizing from my wife, Tenley, who unfortunately couldn't be here today. I learned health care from my coworkers, Mary Ann Gleason, and Ed Farrell, and Lisa Thompson, and many others. And I learned housing when I was working in Philadelphia, fighting against redlining and discrimination, and fighting for tenant rights. And then I found the Colorado Coalition for the Homeless, and I saw it as a vehicle to bring together all of these elements to address one of the most visible manifestations of poverty, social inequality, and injustice that we have seen in our lifetime, that of homelessness. When I started at the Coalition, we had, some 32 years ago, we had a staff of 6 and a budget of $60,000. Today we have a staff of nearly 600 and a budget of $60 million. We started with a small primary care clinic, the Stout Street Clinic. 2 exam rooms. We had a doc, a nurse practitioner, a social worker, a front desk clerk, and an administrator. And as the number of people on the streets grew needing our services, we started adding more docs and more nurses. And when we were unable to get the mental health community to serve the special needs of our population, we started adding psychiatry and counselors. And when the substance treatment agencies would not meet the needs of our population, we started adding addiction counselors. And when we saw the devastating connection between the oral health and the physical health needs of those living on the streets, we added dentistry. And then we realized very early on that if we only provided quality health care to people and then sent them back onto the streets or under the bridges or even into the shelters, that the likelihood that their health outcomes would improve was very low. So when the housing authorities and the nonprofit housing providers were unwilling to house our people, we started buying housing, and then we started building housing. And so over the last 30 years, we've developed more than 1,900 units of housing that we own and operate and manage. And by the end of this month, we will add 1 new building, 100 apartments, permanent supportive housing, to serve chronically homeless individuals who are cycling in and out of our jails as part of our Denver Social Impact Bond Program. And as Bobby indicated, we were able to complete a 54,000 square foot new health center, the Stout Street Health Center, with 78 exam and counseling rooms that fully integrates primary care and behavioral health care with dental, vision care, and pharmacy, with a team-based approach to care in a patient-centered medical home. And in addition to that, we were able to build 78 units of permanent supportive housing on the upper floor of that building. So together, this is the model of integrated health and housing that we believe in, that we believe makes a difference in the lives of those we serve, and that we think is the model for creating lasting solutions for homelessness, not just in Denver, but across the country. Now, we operate a supportive residential community in southeast Colorado that provides recovery-oriented housing with peer supports to 225 chronically homeless individuals who are working on recovery from their addiction and mental health or mental illness. And I recently talked to one of the residents there. His name was Isaiah. And I asked him, "How did you get here?" And he responded with a smirk, "Well, I took the van just like everybody else." But I said, "No, really, what allowed you to take that step to come to Fort Lyon to work on your recovery?" And he responded that after years of living on the streets and living along the South Platte River and meeting our outreach workers from time to time, he woke up one morning and realized that he needed a change. And he said, "I realized I was no longer content with being content with sleeping on the river and hoping that I would wake up the next morning." So the next time the outreach worker came by, I said yes. So I remember that very vividly. He said he was no longer content with being content with his situation. And that's how I feel now, reflecting on 32 years of doing this work. I can no longer remain content of being content to allow things to continue the way that they are. I can no longer remain content being content when too many of our brothers and sisters remain on the streets, under our bridges, and in places that they shouldn't be. And I can no longer be content being content when increasing numbers of mothers and children are sleeping in their cars or sleeping on floors because of the lack of affordable housing. And I can no longer be content being content when too many of our citizens do not have access to the health care they need to survive and to thrive. And I can no longer be content being content when the wealthy and the powerful are no longer just happy to let the poor and the marginalized fall through our shattered safety net, but are actively seeking to further undermine what we have achieved over many years by cutting Medicaid, by cutting Medicare, by cutting Social Security and housing assistance and food stamps. We have come too far to allow this to happen. And I can't continue to be content to being content when our well-meaning friends in Washington seek to ration inadequate resources by creating inefficient systems for targeting resources like coordinated intake and VI SPDATs and time-limited housing subsidies rather than fighting for the level of resources that we know we need to provide adequate housing and health care for all of our people. So as I reflect on this award and my past work, I'm not yet ready to ride off into the sunset, but I'm getting my saddle ready. As I look out across this room, I see many young faces who are part of the next generation of leadership to fight to end homelessness in our country. As my friend Bob Erlenbush points out, many of you are young enough that you have never known a time when there was not widespread homelessness in our country. And that is a terrible thing. We have to fight back against the idea that homelessness is the new normal. As a white man of privilege, I ask you to join me in standing up and fighting back. Fight back against racism. Fight back against oppression. Fight back against sexism and homophobia and other isms that are contributing to social injustice and the rise of homelessness. Stand up to inequality and the notion that we, in the richest country on this planet, do not have sufficient resources to provide safe housing and health care for all of our people. Stand up with me against the forces who believe that people should be forced to work to receive health care or to receive housing or to receive food. And stand up with me against the notion that we just need to tweak the system to find the next best practice or to follow the next great idea coming from our consultants inside of the Beltway, and all will be well. So it is in this vein that I accept this award in the footsteps of Philip Brickner and Jim O'Connell and John Lozier and my friends Mitch Schneider and Michael Snoops, who are no longer with us. I accept this not as a recognition of past achievements, but as a call to action for new leadership to fight for social justice, to fight against oppression, and to end homelessness once and for all. You are all warriors on the front line of the struggle for social justice. Will you stand with me and fight back? Thank you.
I have no fitting words following that to conclude, except to say that together we are and we can and we must continue to build that society that we've seen exemplified in the work of these award winners today. It gives us a great deal of somberness, but also hope and happiness to know that we can and will make progress as long as we do not give up doing what is right. Thank you, and thank them very much.